We appreciate you so much, and we appreciate you sharing your story and continued, even in this recognition of yourself, that you're giving and sharing your story and encouraging others. So thank you so much. Congratulations on a well-deserved award. I have Commissioner Reinhardt with her hand up, and I want to go to Commissioner Reinhardt.
I just want to say thank you for starting out this day and going forward, for being so inspirational. You're changing lives in your work, and even in right today when you were talking, the inspiration that you provided is just absolutely amazing. Thank you.
Thank you.
Thank you very much. Was there anyone else, County Manager O'Connor, on this topic?
Thank you, Madam Chair. We don't have anybody else. Renee, thank you for taking a moment, though, to share your story and represent us all in some way. And you lit up the day for anyone watching, I can tell you that, because my phone lit up with people telling me how much you inspired them. And we would not be the same organization without you. So thanks for being a part of it.
You're welcome. Thank you.
Thank you so much, Renee. All right, now I'm going to turn it over to County Manager O'Connor with hopefully a very good news COVID update. County Manager O'Connor.
I mean, I can't follow that, Madam Chair, but I'm going to do my best. So we have a couple of pieces, and then the public health team will join us today. Director Holly doesn't have a full voice today, so it's going to be some of her team, but she's watching and she's with us the whole way as we go. On the COVID update, you'll hear the numbers from the team today, but you've been seeing how they're coming down precipitously. I think the headline, if you remember just a few pieces from it, and I won't go to the dashboard or anything, but remember we're looking to drop below substantial in two areas as defined by the CDC is how we track risk. One is cases per 100,000, and then the other area is in positivity rate, right, which is tests positive over total number of tests taken, and those are not at-home tests. Those are tests done through official channels. We are now below substantial when it comes to case positivity, and moving toward where we may end up in low at some point going forward. But we're definitely now in the moderate level. And in cases per 100,000, we've seen a precipitous drop from where we started. While we remain high, we're optimistic about what it means for the coming weeks. So there are three pieces I would just share that this really means for us in terms of our policy and where we go. Masking policy, our meeting policy, not only for the board, but all the other groups that follow similar guidance from the board. And then our phase one, return to office of our three phases. It was instituted back in November and immediately went into remote first, right as Omicron joined us. So that has never yet been actually phase one getting to start up. You're going to hear more next week on all three topics, but we're working very closely with public health in these spaces as our numbers come down. We're not quite there, and we know everybody wants to move all the time. We remain red on the CDC county map, but we're watching it every day, and we're talking to public health. They're doing a great job with us. And I think in the weeks to come, you can expect changes. You can expect positive changes in terms of our ability to move out of a full remote first environment. I'll take questions on that at the end, Madam Chair, if we have them. Other than that, I want to go to our public health team to share some more of the specific information with you. Dr. Ogawa.
Good morning. It is me speaking this morning. So thank you for having us. Good morning, Madam Chair, Commissioners, and County Manager. Just as County Manager O'Connor mentioned, Omicron remains the dominant COVID variant across the U.S. We're still experiencing high levels of community transmission across the US and Minnesota. We are red still on the CDC map. But the good news is we are seeing cases sharply decline, as sharp of a decline as we saw them rise. As of yesterday, CDC reports Ramsey County at 252 cases per 100,000. So we do remain in that high level, and a weekly positivity at 6.4%, which is again, among those laboratory confirmed tests, and is inching towards low numbers. We're still urging people to get vaccinated and boosted when eligible. A reminder that Moderna and Pfizer are both fully approved by the FDA for certain ages. And we know that the risk drops for hospitalization and increased protection as individuals get vaccinated with the 2-dose series and with the booster. Public Health is currently offering Pfizer or Moderna boosters for anyone over the age of 12 who received their second dose of Pfizer and Moderna at least 5 months ago. We also offer Johnson & Johnson vaccine or a booster with the others if they received their Johnson & Johnson 2 months ago. For the week of February 21st through 28th, we expect to administer about 300 doses of the vaccine. You can get your second dose or booster shot with Ramsey County, even if you got your first dose anywhere else. Unfortunately, Pfizer postponed their request for the FDA authorization of COVID-19 vaccine for children 6 months to 4 years old. The Advisory Committee on Immunization Practices, or ACIP, meeting, originally scheduled for last week, has been postponed as well. Pfizer said tests showed that 2 of the smaller vaccine did not generate enough of a strong immune response, and so they were in the process of testing a 3rd dose. The good news here is that this means the FDA, Pfizer, and ACIP are being careful about making promises that they cannot keep, and thus waiting for the data to support true protection for those children aged 6 months to 4 years. We are still strongly recommending universal masking in public indoor settings during high substantial county transmission. We know that that layer of mitigation is extremely important. St. Paul Ramsey County received over 90,000 N95s from the Minnesota Department of Health. We're working to distribute these masks to residents, businesses, community organizations through the Mask for Everyone initiative. Last week, staff and MRC volunteers processed 568 separate orders of those masks for our residents. We urge people to continue to test on a regular basis, as there are many COVID testing sites, including our site, through the end of this month at Frogtown Community Center. St. Paul Ramsey County Public Health will receive 9,000 at-home rapid antigen tests soon, and these will also be distributed to residents in the community through many of our channels that we've utilized before: schools, shelters, trusted messengers. Just also wanted to mention that the National Institute of Health is launching a national study to investigate long-term impacts of COVID, recovercovid.org, and it's seeking individuals in the community to begin looking at long haul or longer effects. I'll be doing another one of my virtual community conversations on Wednesday, February 23rd from 4 to 5 via Zoom. Just thought I'd throw in a plug for myself to talk more about the things we've talked about, though: COVID-19 child vaccines, travel, KN95s, N95s, and masking. And anyone can find the information on the website, www.ramseycounty.us. That's our brief update, and I will turn it back to County Manager O'Connor.
Thanks, Madam Chair. I will, on behalf of the team here, we'll stand for any questions and go from there.
Great, thank you. And thank you, Dr. Ogawa, for great and for sharing your Zoom feed. I know that the community really, really enjoys that, as do I. I'll start with Commissioner Reinhardt and then go to Commissioner McGuire.
Again, thank you for the great work you do and making sure that everybody is informed on what's going on. And finally, we have some good news. I mean, it's not 24 point something percent. That one really scared me, I have to tell you. I have one question and then one comment. Okay, I'm trying to remember, is it substantial, then high, then moderate, then low, or is that the correct order?
Madam Chair, Commissioner Reinhardt, it's high, then substantial, then moderate, and then low.
Okay.
Which is confusing. So we view it as 2 zones: high and substantial, bad; low and moderate, not as bad, much better.
Okay. Thank you. I couldn't remember exactly which order they went in, but that makes sense. And then I just wanted to comment, because I know that my granddaughter was talking to me last night about the fact that she got to choose whether or not to wear a mask today. in the White Bear Lake schools. And so she talked a little bit about that with me, because at 9, to have that freedom to make a decision and how she wanted to be informed about it, I thought was pretty impressive. Because I said to her, the reason why you wear the mask is not really to protect you, it's to protect the people around you. And so that's why I wear a mask. And so she was making her decision, and she was going to think about it. And I just wanted to make sure that everybody really understands the primary reason for wearing the mask is to protect others around you. So I thought I would share that. Thank you.
Thank you, Chair Reinhardt. Commissioner McGuire.
Thank you, Madam Chair, and thanks, Dr. Ogawa and Director Holly and everyone for all of your work on this. We know it's continuing to be a lot of work to do all of this. And so my question is about the mental health of all of the people of all of our residents. We've been having conversations on the Ramsey County League of Local Governments about, what sessions we should have. And we're thinking of having a session on, coping with COVID, sort of the mental health strain, the communal trauma that we're all dealing with. And can you just comment a little bit on how we might be thinking about helping our residents with how we're dealing with all of this? And then even coming back as we think of meeting in person and points, not going back to work because we've always been working, but going back in person, the tensions that people are feeling. I don't know if we're thinking about that, but I know that that's on a lot of people's minds.
I think I'm the only one on right now.
Yeah.
This is just a question. You may not have a full
That's okay.
answer to this, but I just think it's something we all need to be looking at.
Commissioner McGuire, Madam Chair, while I am a family physician, we take care of individuals as a whole, and we know that our mental health and our experiences dramatically affect our physical health. And so I think that it's exceptionally important. We know also that the beginning of the COVID pandemic created a feeling of isolation for so many of our residents, and coming together again brings with it both the positive of not being alone, but the stress of still being concerned about the infection and the societal stress again. So I think it's really important. It's true. I don't have an answer other than I think keeping it in the front and being aware of it and recognizing that sort of like the precipitous drop of cases, we need to not throw everybody back into a situation as fast because of those changes. So that's what I would have to say at this point. But yeah, I think keeping that in mind is exceptionally important.
Thank you.
Madam Chair, if I could just add briefly, I want to give voice to where Dr. Ogawa ended. I want to acknowledge, like in the return to work, even phase 1, which is a relatively small group of our organization, it'll crescendo and get larger in phase 2, which is set to happen not sooner than 60 days before phase 1, and then phase 3. This falls on our employees as well. And I want to give voice to the idea that while many people are very excited to be able to work in different ways, to be able to see people they haven't seen in a long time, for new employees to be a part of an office environment they've never had an opportunity to be a part of and understand what does it mean to connect and find different ways to get to do that in physical spaces sometimes, as well as in hybrid ways of getting your work done. There are some people that this is a very difficult moment as we talk about transitions. And there's a variety of reasons for what that can be. But I just want to acknowledge that piece as we go. And we're trying to be thoughtful on that. It's why we are trying to build timelines in for notice and awareness. We're working with people one-to-one. And so it's going to continue to be present. And I think for anyone who's spent time coming back into spaces where maybe for a while the pandemic took them out, whether socially or professionally, you find that first step back in, it's like putting your foot into a pool. You're trying to figure it out. and then it often gets better, right? But for everyone, it's a little bit different, and that's going to be a part of our story here over the months ahead.
Thank you, County Manager
Thank you.
O'Connor. Commissioner Fretham.
Yeah, Dr. Ogawa, I was hoping in response to Commissioner Reinhardt's comments about masking and protecting others, I know that's the case with our cloth masks, and that was one of the reasons why they were pushed. But my understanding is that if you are wearing a well-fitted N95 or KN95, there actually is a significant amount of protection to you. And I'm wondering if you can speak to that, because I think that also might, for folks who are worried about returning to in-person environments, or for are immunocompromised or have other risk factors where a vaccine might not be as effective for them, or they can't receive it, how wearing a quality mask could protect them in return to in-person.
Commissioner Fretham, Madam Chair, yes, actually, very much so. So one of the reasons that we have also expanded our distribution of N95s through Mask for Everyone is that we do recognize that not only does wearing a mask protect those around you, but if it's an adequate mask, it also increases your protection, your individual protection. We know that N95s and even standard surgical masks do block the inhalation of the particles as well. And so it is exceptionally important for both protecting others and protecting yourself when using a mask.
Thank you. I don't see any other hands up. Thank you again for a great update and taking the whole burden for the team. I appreciate you, and I know the team is behind you working. Thanks very much, Dr. Ogawa. We will now move on to our administrative item. Commissioner McGuire.
Thank you, Madam Chair. I move item number 4, amendment number 1 to lease agreement with Metropolitan Council at Ramsey County Metro Square Building. Item number 5 is single source agreement with the W.H. Haywood Burns Institute for a learning community cohort. Item number 6, professional services agreements with Holiday Station Stores and Burlington Stores Incorporated for gift cards. Number 7, State of Minnesota General Obligation Bond Declaration for Keller Regional Park. Number 8, reinstatement of a sales contract for deed for a tax forfeited property located at 759 Cook Avenue, East St. Paul. Now, item number 9, Public Works Construction Quarterly Report for October 1st, 2021 through December 31st, 2021. And item number 10, the December 2021 report of contracts, grant and revenue agreements, emergency purchases, sole source, single source purchases, and final payment. And I move all of those, Madam Chair.
Second.
Great. We have a motion and a second. Any discussion on those items? All right, seeing none, we'll go to a roll call, please.
McGuire,
Aye.
Ortega,
Aye.
Reinhardt,
Aye.
Carter,
Aye.
Fretham,
Aye.
McDonough,
Aye.
and Matas Castillo.
Aye. Okay, we have one policy item, and that is our Ramsey County vision, mission, and goals. County Manager O'Connor.
I'm sorry, Madam Chair. That was a 2 for, I think we have 2 policy items, the first of 2. That's all.
You're correct. I have to look a little further down my list, but we'll start with the first one. And this is a restatement of our Ramsey vision. Do we need to make a motion on this? I'm sorry.
Move approval.
Great.
Move
Second.
approval of the items.
Great.
Second.
Any discussion? Yes.
Madam,
Yep, Commissioner McDonough, please.
thank you, Chair Matas Castillo. I just want to take a moment to just acknowledge the work we've done to reinforce that we are on a good track here with our mission and vision and values and goals. And the work that we've done over the last 5 years has led us to this point where we are validating these and confirming that the path we're on is the path that will benefit our residents the most. And I just wanted to take a moment to recognize that and thank everybody who's worked on that, all my colleagues here. I think I just couldn't be more proud of this path that we are on and being a mission-driven organization. And the mission and the vision that we put forward here to drive our decision making is, I think, stellar. So thank you for the opportunity to just say that.
Thank you, Commissioner McDonough. It is a good point. We want to also give a special thank you to Elizabeth Colesman, who has helped us with crafting the language and the words as well. So with that, I would like to go to a vote. Me.
McGuire,
Aye. Aye.
Ortega,
Aye.
Reinhardt,
Aye.
Carter,
Aye.
Brother,
Aye.
McDonough,
Aye.
and Maras Castillo.
Thank you. And now we'll move to one more policy item, the presentation of our housing facility project updates. County Manager O'Connor.
Thank you, Madam Chair. I'll get us kicked off, and then we have some information to share with you today. And it all builds on a later conversation shared by Commissioner McDonough this morning, in which the Continuum of Care, our broader coalition of members who work on our continuum together around homelessness, will present more about the broad work together. And actually, we'll start there. This is not a Ramsey County issue. I was in a space last week where I was reminding someone that it is a community issue. It's an issue of which Ramsey County is but one of many important partners. We are a backbone organization in terms of staffing the continuum of care and seeing the work through. But we do not do that work in a vacuum. And it is important to acknowledge the community members and community partners who give of their time in our continued path forward. Just a few notes from me. We've had continued work on progress in collaboration with state partners, including Commissioner McDonough and Commissioner Maras Castillo being close to those conversations with the governor's office, the lieutenant governor, staff from all related agencies, City of St. Paul, and many other partners as well. There's an upcoming conversation happening that will involve Lieutenant Governor, where we continue to talk about the urgent need around homelessness and an upcoming fiscal cliff that we've described here many times in the past. It's important to continue to describe. We're talking about hundreds of individuals who may find themselves without the same level of options, of dignified emergency options, and end up unhoused without solutions coming to the table during this spring as we near the end of winter. Today's weather is a chance to, again, be reminded of how dire and serious these topics are. And thinking back only a few years in the numbers that Director Lattimore is about to share with you reminds us where we came from and how important it is that we not go backwards, particularly at a time when the state is working through a $7 billion surplus, a historic record. It feels like ensuring basic stability could be one of those tenets at this time. I want to thank the governor's office and their staff. They were unable to join this morning for the conversation, but remain deeply engaged in those dialogues, and we'll continue to work with them going forward. Part of the message there, obviously, is the need to work in collaboration with the entire legislature, which involves the House and the Senate as well. And it's important to see movement happening on all fronts. And so I just wanted to give voice to all that and appreciate it. As we move forward, we do this in partnership with so many others. I'm going to turn it over to Keith Lattimore, our Director of Housing Stability, who has some information to share as a follow-up to some other conversations we've had that really shows the progress Ramsey County has made as a community during COVID-19 in addressing housing instability. Director Lattimore.
Thank you and good morning, Madam Chair, fellow commissioners, and County Manager O'Connor. Last month we came to just give you a brief overview about the emergency shelters that were set up during our COVID-19 emergency. And we wanted to come back monthly to just share with you and really give some context to what we speak about. So you had some understanding of what we are going through as we move to work our way to May, if you will. And so what you see on the screen right now is really the census. And this was taken last week, but when I looked this morning just to see where we were, we are not too far off. And these are numbers. If you look at the total resident column on this particular census data, this tells us how many individuals we are currently sheltering within our 3 sites, but 4 programs. And those sites are Mary Hall, Luther Stubb Hall, and Bethesda Shelter. And inside of Bethesda Shelter, as we know, we also have our respite program that house those individuals who have tested positive or are symptomatic in our shelter network. And so if you look today, we're at 298 roughly. That number has kind of stayed in that area of late. We do notice that in our respite, our numbers are down, as indicated by our presentation from our public health department to talk about the COVID cases that are currently in shelter as well. So we've seen a significant drop, and this is really a testament of kind of how we had been before Omicron version came. We did see those numbers spike up pretty high, nearly 50. And so that's down from our highest. And so we're appreciative of that as we watch to see what this means. So as we could get closer to May, I brought my team here, and we'll be sharing with you so you can get a context of who are these individuals and how they are going to be impacted as we move to May. And if May were today, I wanted to give you kind of a point in time presentation so you can see if May were today, this is how many individuals are affected by us not having the funds to continue onward. And we wanted to keep this front and center as we move to trying to continue to work with our partners. And obviously you've heard from County Manager O'Connor and obviously Commissioner McDonough and Madam Chair are working with us through our continuum of care, of which you'll hear more about in today's afternoon presentation or workshop on the continuum of care. You'll hear more about that. But just really how important it is for us to continue to move forward, because this issue does not go away as our funds, deplete and are projected to be out in May. So these are some efforts. We wanted to just give you those numbers. And I brought my team with me today, and they'll be going through some slides just so you can really put, well, not really faces, but you can put context around who are the individuals that we are, housing and we're providing shelter for, and what that means if everything were to stop today. Over 300 individuals wouldn't have a place to go. So we wanted to just kind of bring that to your attention, and also we'll bring promise to come back monthly to just give you updates and kind of where we are, and then hopefully between now and then we'll have some significant updates as we come back monthly up until May. So with that, I'll turn it over to, we have Mark Hurstfield and Joseph DeSinclos, who will take us through our next slides.
And Keith, actually, aren't the numbers a little bit higher because this doesn't reflect the family shelter system as well? So the numbers are actually higher than this come May.
Yes, that is correct, Madam Chair.
Thank you.
Next slide.
Thank you, Keith. Good morning, Madam Chair, fellow commissioners, and County Manager O'Connor. I'm Joseph DeSunclose from Research and Evaluation, and my colleague Mark Hurstfield and I are going to walk through an update on the COVID shelters. So what you see here is, as of late January 2022, the unduplicated total persons in our shelter, or our COVID shelters. And as you can see, African Americans are at the top at 42%, with white counterparts at 36%. But to dig a little deeper into this issue around race, we did a disparities ratio. So when we look at the entire system, when you compare Latinx with their white counterparts, they're twice as likely to be homeless in Ramsey County. American Indians are 14.5 times as likely, and African Americans are 8.7 times as likely as their white counterparts to be homeless. Next slide, please, and I'll pass it to Mark.
Thank you, Joseph. Good morning, Madam Chair and County Commissioners. I'm Mark Hertzfeld. I work in the Research and Evaluation Unit for Health and Wellness and for the Housing Stability Department. This is a map of our shelters as of September of 2021. The red squares are the Ramsey County COVID response shelters as of that time. Two of those shelters have now, hotel shelters have now closed, and I'll show those on the next slide. But this shows the distribution of all our shelters, and all but one are within St. Paul. The black triangle are the family shelters with the Family Service Center in Maplewood. These symbols are not to scale for the number of beds, so the youth shelters are much smaller. The downtown shelters are much bigger, including Catholic Charities and our Model Cities shelters. But this just shows the geographic distribution. Next slide, please. This is a weekly count of two things. The blue line is the estimate of camp occupants by the city of St. Paul for the number of people in camps on a weekly count that we got from them through the end of 2021. The red lines and the red circles represent our weekly count of RC COVID bed response. This is just the Ramsey County COVID shelters in particular. And the key point is in very late December of 2020, we opened 2 new shelters early in that winter. At the same time, the camp occupants decreased rather quickly into February of 2021. We've now have 2 of the hotel shelters have closed in the fall of 2021, shown here. Now, since then, Catholic Charities, Higher Ground, has increased their bed capacity a little bit as they get out of, try to recover from COVID. So that would be reflected in January of 2022. But this is comparing, again, this is comparing the camp occupants to our Ramsey County COVID beds for single adults. And I'll pass it back to Joseph.
Okay, this next slide is the last known permanent address. So of the little over 18,000 or 1,800 people served through late January 2022, majority of our residents served were from Ramsey County. Next was outside of Ramsey County and surrounding suburbs and greater Minnesota. And then outside of Minnesota, it was at 18%. Why is this slide important? There's 2 things. 2 things is there's a myth that a lot of people are just coming from Chicago, Illinois, and entering homelessness in Ramsey County. That's been a myth that's gone on for years. Then the other thing, just in planning purposes, it's important to note that even in surrounding counties or even greater Minnesota up north, there's not a large capacity of resources there. So oftentimes people from outside of Ramsey County are coming to Ramsey County to seek services. Next slide, please. Good. This last slide is approximately a little over 950 people in point in time. This is November 2021. And as County Manager O'Connor and Director Lattimore described, what we know is that we have a little over 600 shelter beds that would be available in May, and 337 people may not have a shelter space to go to by May 2022. So these are the folks that are facing the cliff. We can't predict if they're going to go into shelter, if they're going to go into encampments, but what we do know is that there's a little over 300 people that would not have access to a secure shelter bed, emergency shelter bed. Next slide. And I believe this goes on him.
No, actually, I'll jump in. So I think that, what we wanted to show here is that we do know, so what are our options and how do we move as we get closer to May? What are some of the things that we can do as housing stability to work with our partners around mitigating the number of individuals who would be facing homelessness or unsheltering when, once May comes? And although we're doing the work and, we're working with the state to try to get, some relief as we move closer to May, there's still a potential between the end, from May and when those funds might be available. So there are efforts working through our continuum of care to see what can we do and how can we come up with, mitigating those who might be at risk. And we look at, one site is obviously Bethesda. We know that there is no extension there. So there is no real possibility if funds were to come that we can remain in that location. So at some point, my team and I have to decide as to when we will no longer allow folks to make have referrals into the system, so to speak. So at some point, we have to gear up to say that Bethesda is going to be no longer a place for us to use. And with that meaning that May, we have to actually be out. And that doesn't mean on our way out. We have to physically be out, which means that, there are items, there are bunks, there are other things that are there that needs to be cleared out of that facility and be, so we can be in preparation for moving out. We also have this thing we call our, as we look at the weather today, we have our extreme weather protocol. So we're trying to see how do we make sure that we can get through our extreme weather protocol months, those that are critical, and have places for individuals who are outside to be able to come inside still when we still have those real extreme weather days. And so that's just one thing there. And Bethesda obviously has a capacity of 100 for shelter, and we have technically a license for up to 64 for respite. So those are the things that we have our conditional use permits that expire in May. And those are things that as housing stability start looking at what are our options, we know that that location will not be available for us to extend. If we look at Mary Hall, we did get some good news that, if we do get the funding and we're able to, Mary Hall, the absolute end date that we can stay in Mary Hall is actually August 15th. And so although we're, funded through May, if funds come, we have some relief that we can have a few more months till we can maybe find options or find different ways, or perhaps maybe, state comes in and we have some funding to either, find another location or extend that location out a little further so we don't have 300 individuals perhaps losing, their shelter beds. And then finally, our Luther Stube Hall is actually the way that it's, pronounced there. We are in conversations around Stube Hall, and I believe there are 70 beds there that, according to May, we would have to find different locations, or those individuals would be at risk of not having locations. As Madam Chair, Madam Castile mentioned, this does not show our family shelter as well. And we know that one of, the big four, that we are calling it, as far as our recommendations from our continuum of care on what they recommended that, they support moving forward, those items. And again, you'll hear more about them this afternoon. Those items, number one, is that they support and they believe that we should have I'll call it a Bethesda-like shelter for 100 individual singles. They also indicated that they would like to see a 100-bed day shelter. They'd also like to see a 100-bed family shelter. And then finally, the fourth recommendation is that they wanted to sponsor this program, which we call Familiar Faces. And again, you'll hear more about that this afternoon, but for today's presentation, we wanted to talk about those familiar faces are individuals who have high use of systems, and they're the ones who, may show up in our emergency rooms, hospitals. They're the ones that we see and know very frequently because they have severe needs, and we're hoping to be able to have space that can cover those individuals and make sure that they're in better places as we move forward. So those are our big four, and again, you'll hear more about this this afternoon. So the 100 that you don't see here, those are families, those are kids, and their parents. So that's not reflected here, but that one too is one that we wanted to mention here. So you have that as kind of in your radar as we move closer to May to say what happens in May. And then finally, how do we address that? So right now we're working with our partners, Catholic Charities. We're working with Union Gospel Mission to look and verify that the spaces that they currently have that's not being utilized, and these are spaces that typically require what we refer to as pay for stay. How do we make sure we bring those beds online to make that the individuals who could be facing the May cliff, how do we make sure that those beds are being utilized so we don't have as many people perhaps facing that? So we're doing some work there. We're also working with our partners at SPOC. And, we have a number of people that are coming together to wrap their arms around it to see if we can continue to make referrals and move people into permanent housing or temporary housing or transitional housing. So all of those efforts are being made as we move there, and those efforts don't stop. So I wanted you to be aware that there is we have all hands on deck that's trying to make sure that we are, doing our due diligence to get people to continue to move and just not sitting, and just waiting for May to happen. We have a lot of efforts there to be able to try to get those individuals moved. However, we do have to prepare for the worst. And that is, what do we do when May comes and we still have individuals in shelter? What are some of the things that we can do to try to bridge or find, some opportunities to move people along? We will say that there are some efforts through philanthropy that is happening through our continuum of care. So in partnership with our continuum of care partnership, there is money that is being sought after from business owners and private individuals. So that is helping. But again, these are bigger efforts, and we still feel like there's going to be some things that we have to be aware of, and as we move forward. Finally, last slide, I'll turn it over to Deputy Director Kim Clementon.
Good morning, Madam Chair, Commissioners, and County Manager O'Connor. We are pleased to report that SPOC is an active service center for residents at this time. And as you can see, we have a number of Ramsey County as well as community partners that are on site Monday through Friday each week. We are continuing to build SPOC as a community resource for people across the whole continuum of homelessness, and are actually getting more and more partners all the time. We're currently in talks with a few more community partners that want to join us fairly soon as well. So things are going really well there. Thank you.
Madam Chair, as we wrap this part up, thanks to the team. If you could go back to slide 4, I want to raise slide 4. 2 points along the way. One, and Director Lattimore did a good job of mentioning, there are different ways to look at our system. These are the Ramsey County emergency shelters that the county individually stood up and financed during COVID. Interfaith Actions work at Carondelet is another important piece to this puzzle. You'll hear more about as the collective with the continuum of care today. And as these slides move forward and we use them in different ways, we'll make sure that's on here as well, because in many ways that moves as part of the continuum. Then there's Catholic Charities, and there is Union Gospel Mission, who have been long partners in this community. Those beds are not accounted for here, which is not to minimize their previous and ongoing importance to our overall system. But it does give you a general cut at some of what we are talking about in terms of numbers and need at this tough time. I went back to slide 4 because early on in my tenure, when I was sitting at a table that Commissioner McDonough has mentioned before, it was rush outside in is what it was called before we got to this revamped continuum of care. Someone there commented on how a lack of investment over time in housing supports at the federal level had finally hit the point where we were seeing it manifest itself locally. And I had never heard it that poignantly delivered to me. And I quite frankly wasn't here during the time of disinvestment. And so that was not an arc of history that I had alone. And someone who had been through that shared that with me. When I see this, it shows how supply is related to the level of dire need. And by the way, shelter isn't the goal. The goal is housing, which doesn't even show up on this chart. But I think it's important to say this is one step along a bigger continuum. And I wanted to end that part by saying the blue line is not data that was Ramsey County data. That's St. Paul data. The orange line is Ramsey County data. And so what it says is when you map two systems who are tracking different spots in the system off each other, as we brought capacity online, St. Paul immediately saw an impact on who is impacted. And we know that if you take this information and lay it with slide 5, which showed those different areas of last known address, anywhere you do this, we will see a similar result happen, which is why homelessness remains an issue that matters here locally, but it matters across our region and across our state. Thank you, Madam Chair, and thanks to the team for presenting.
Thank you, County Manager O'Connor, for that wrap up. I have a couple hands up. Commissioner Reinhardt had her hand up, and then Commissioner McDonough. Commissioner Reinhardt.
Thank you, Madam Chair. And actually, I had a number of questions, but I think that somehow County Manager O'Connor read my mind and he answered most of them. But I do think it's important to note that this is my biggest question, which he answered, or comment was regarding all of the other work that's being done throughout our county, the churches, the nonprofits that are out there and serving people as well. And so it's part of a larger organization, and thank goodness we have that. By the way, I love the name Spock. It makes it sound so hopeful. So, and just moving forward. Thank you.
Thank you, Commissioner Reinhardt. Commissioner McDonough.
Yep, thanks, Madam Chair. A couple comments, and Ryan, you did catch one of these. I really think we need to make sure we're adding provincial health and the families into all these slides. It just, you know, the fact that you called it out, Keith, and, you know, but people are watching, they see these, and they need to know that the families are part of this, that we're funding that with CARES funding. It's in the same situation as Bethesda and Luther. And we need to make sure that those numbers are there, not only to just validate the work that's going on, but also recognize the problem is this other leg here component, and that's the investment we're making in families, and we're going to potentially lose that intake to it. So we just need to make sure we're including those numbers in there. I'm not sure why that didn't happen, but. And then if you could go back to the slide that had the percentages from where folks are coming from, I just wanted to reinforce something there. Yep, that one. And Joseph called it out a little bit, but I want to be much more transparent here. You know, because he called out two reasons why this slide is important, and they are two good reasons. But the third reason, or expanding on one of them, really highlights why the need for partnership is so important. Because when you add outside Minnesota and outside Ramsey County, we're well over the 42% coming from the county. And that's why the importance of a state partnership, but not only a state partnership, a regional partnership here in the solutions, both on the funding side and providing service side. You know, I'm hearing that Washington County is preparing to potentially open up a shelter. Dakota County might be doing that also. It's long overdue and well needed, and we need to see those investments from our regional partners because they are a part of the solution. And, you know, as Joseph pointed out, if there are not options, folks will move. And if those options don't meet the individual's need, at least to a basic minimum, they will gravitate to where that they can get those issues addressed. And for the most part, it is the urban core, the two cities, the two urban counties. So it really does highlight the need for that partnership. And I appreciate the work, Keith, you and your team are doing, and look forward to this afternoon and a deeper dive on all this. Thank you.
Thank you, Commissioner McDonough. And I just want to clarify that at 10:30, we're going into the COC workshop. So we're going to go deep. It's not this afternoon. It's right away this morning. We're going to go here in just a few minutes even deeper on these issues around who we're serving, how we're serving it, and our strategy. So just want to clarify that. I know we mentioned a couple times this afternoon, but it's actually this morning right away. So Commissioner McGuire.
Thank you, Madam Chair. Just appreciate the comments of my colleagues. Jim, you said a lot of what I wanted to say, which was we should really put this in the slides, that the slides should reflect this. And I have another point that when you say COVID, when you have COVID facilities, it doesn't always say COVID response. It just says COVID. And so I was thinking, oh, are these all the people that have COVID that are going into those? So for people, and you are all working with these numbers, I mean, I know that it's not true, but we maybe need to always say COVID response when you're saying COVID beds, because it seems like they're COVID people, the people that have COVID, and that's not the case. I'm confident. So we always need to say COVID response in all of our charts and everything. So I know it's been it's abbreviated, but just be careful because other people are watching this. And I totally agree with Commissioner McDonough on this chart about who we are serving, that we are, you know, outside Ramsey and outside Minnesota are high, and we need to, that's why we're asking the state for funding and the federal government and regional response. So I'm just gonna highlight that as well, what Commissioner McDonough said. And this is a chart we should bring with us when we talk to legislators about why we need help from them. Anyway, thank you.
Thank you very much. We are gonna thank you, and because Commissioner McDonough, you have your hand up and your camera off.
Camera's on.
There you go.
I'll lower my hand and I'll be quick. I did have one more point and I just remembered it. Keith, on your first slide there, and you did call it out, but I think it's important for us. Part of the need for us to add all the, the care, I call them CARES funded beds in the response to COVID, right? Was the need for Catholic Charities to dramatically reduce its population count to keep those folks safe, right? And so part of a really critical piece to this is as they need to be ramping up as they are able to ramp up. And they reduced well over 100 shelter beds between the paper stay and the shelter. And so I think it would be helpful for us on that first slide where you're tracking all those, or one of these slides for us to start tracking Catholic Charities and their ability to bring on more beds, because that is a big part of the solution for your 298 that will, not have housing in the CARES funded beds that, we have this May piece, but hopefully by May, and as COVID and Omicron and all these issues are dramatically reducing, and partnering with Catholic Charities, we can continue to get them to ramp up. And so somewhere here, I think we need to start tracking that, because it's not just getting more funding to continue these, it's getting them to ramp up to help minimize our need to provide the identical number of beds after May 1st.
Thank you, Commissioner McDonough. All right, we're gonna end this part of our presentation and move on to the rest of our agenda so we can keep on track for our 10:30 workshop. The next thing on the agenda is the revised Parks and Rec ordinance. Is there a motion and a second?
So move, Madam Chair.
So move. Second.
Thank you. Motion and a second. Is there any discussion on the revised Parks and Rec ordinance? Commissioner Pretham.
I just want to commend the Parks Department on their efforts and outreach. And I know there was a lot of feelings about this process, but I think it engaged the community more than most ordinances would. And we got a lot of really good feedback, and it was taken into account in this revised ordinance. So I appreciate that effort to reach out, even as it may have been challenging for a lot of our park staff. And I know we continue to learn the best ways to reach out and gather information and engaging in these projects. And I know it's not an ordinance that everyone loves, but I think we were able to find consensus around what we heard and come up with something that is updated and better meets the needs of our community than the previous ordinance. So thanks, everyone.
Thank you, Commissioner Pretham. Well said. All right, with that, let's go to a roll call vote, please.
McGuire,
Aye.
Ortega,
Aye.
Reinhardt,
Aye.
Carter,
Aye.
Bretham,
Aye.
McDonough,
Aye.
and Mattis Castillo.
Aye. Thank you very much. And Commissioner McGuire with the legislative update, please.
Thanks, Madam Chair. Was a lot going on this week. We all know that redistricting happened last week. Maps released by the court drew the new lines. Ramsey County is still in District 4 congressionally, which is Congresswoman McCollum's district. The metro boundaries didn't change too much for her on that. But on the legislative front, we're all aware of the changes within those seats. And unfortunately, in Ramsey County, we had 3 pairings, which of really good legislators. So I know we're all very disappointed with that. But in the Senate, we have Senator Isaacson and Senator Marty paired. And in the House, we have Representative Bernardi and Representative Feist in the same district. And then another district has Representative Lilly and Representative Fisher. And we're very sad by this, that if they don't move, or if they don't have a district to move into, so we will lose some of our really good Ramsey County members. So we'll see what that's to be determined what will happen in those seats. Also, just a quick update that a number of us were at the National Association of Counties Legislative Conference in Washington, D.C. Some of us did it in person and some of us actually did it virtually. We had visits, those of us that were there in person, that had visits with Senator Tina Smith in the Senate office building, and Senator Klobuchar actually came to our hotel to talk to our Minnesota delegation. So we were able to have conversations with them, and Senator Smith really helped us, was focused on housing issues, and we were grateful for that. We were fortunate that President Biden spoke, as a number of cabinet members from this administration, Secretary Buttigieg, and a number of deputy secretaries talked about the American Rescue Plan implementation. And so we're really grateful for the partnership that we have with this administration. I was very lucky to be able to meet the president and thank him for his visit several years ago to the depot, when I think a number of us met him, and remind him about that and how grateful we were. And of course, he loves trains, so he remembered our depot and how he loves that effort. So just want to also remind people that we have our Association of Minnesota Counties, our state association legislative conference is coming up next week, and so we'll be meeting with our legislators at the state level during that. That's next week. So lots of things going on. I know a number of us are being called to do hearings, so just keep our government relations staff notified, and also thanks to Jennifer O'Rourke and Melissa Finnegan for all their work. Thank you, Madam Chair.
Thank you, Commissioner McGuire. We'll now go to County Manager O'Connor for County Connection.
Thank you, Madam Chair. 2 updates. If you look at the council chambers screen, you will see 3 new members of the county manager's office in there as admin planning assistants. Kirk, Charlotte, and Teng Yang are all sitting in the audience. They should wave. There's a wave. As you get a chance to come back into the office, I just wanted to issue them a welcome. They're getting to observe what a virtual board meeting looks like, and hopefully soon they can compare notes to when it's a non-virtual board meeting and they can see it together. But just wanted to give a shout out and thanks to the camera for scrolling on over. I appreciate it. Final update today. Last week, I had an opportunity to participate in a Zoom meeting with the White House that was related to violence prevention and the investments happening across some communities around the country. There are 16, I believe, communities, St. Paul being one of them, that was selected for a White House initiative around violence prevention. And as a county who's close to the work, they asked if I could sit in on the meeting. It was led by Julie Rodriguez, the Director of White House Intergovernmental Affairs, and Susan Rice, the Director of the Domestic Policy Council for the United States. And through the presentation, a number of communities, Detroit, Chicago, I'm going to forget some of the others that presented, I apologize, but there were a series, 16, they cut across the nation. They're not all just big, large urban areas, although that's generally sort of a theme. Talked about their work underway in the spaces of violence prevention. And I know it's been a really hard time here locally in our community and across our region, and I want to give voice to that. Alongside that, though, I want to bring a note of optimism. When you listen to the national presentations right now on research-based best practices in terms of what has proven effective at deterrence and long-term strategies to prevent violence by moving people away from the community need to feel that impact, hospital intervention, group and work around violence prevention on the street, which we call healing streets here locally. The hospital intervention is also a part of that, working directly then in partnership across law enforcement and trusted community messengers and partners becomes a part of that work, right? The work that has been happening here fits with the holistic package that you see through these national presentations. And then when you hear the dollar amounts that through alternative response has been invested by the county board and you compare it to regions around the country, you see that we are making some of the largest investments anywhere in the country in research-based, focused improvements at trying to make communities safer for everybody. And I truly believe that the work that the board has been supportive of and authorized and moving forward is truly demonstrating how you piece together multiple pieces at one time in a focused effort that moves forward. It's important to have partnerships with our cities as well as a part of that work, and we'll continue to do that. But I just wanted to give voice to that earlier ARPA investment in violence prevention and how it will come back, and getting to see that on a national context and see how this county is leading work around the country and bringing all the various elements together offers much hope. And it's been a tough time to always see hope in the near term. I will end on just saying we saw pedestrian fatalities are at an all-time high or at a decades-long high. And we've seen similar stories across different trends. It's been a very difficult time for society at large, and gun violence and violence in general has become a part of that narrative in different ways, alongside automobile and pedestrian violence, for example. We need to address all of it. It's why we're excited to see COVID numbers come down again as well. And I just wanted to give you that update to share how we're connecting across the country on this important work. That's all I have, Madam Chair. Thank you.
Thank you very much, County Manager O'Connor. We will go to outside board and committee reports. I'm going to jump right to Commissioner Ortega.
Thank you, Madam Chair. Two quick updates. Met with Representative Erdahl regarding River's Edge. Very positive, and I think he's going to be an advocate for us for the project. The other is, I think yourself and myself, and I think Tony, we were at the Chamber of Commerce annual meeting. It was good to see so many people starting to come out and getting things back to its more regular routine. Thank you, Madam Chair.
Thank you, Commissioner Ortega. Commissioner Reinhardt.
Thank you, Madam Chair. Given the tight time frame we have today, I'll just hold until next week on any reports. Thank you.
Great, thank you. Commissioner Carter.
Thank you. I'll do the same.
Thank you. Commissioner Prada.
I'll go ahead and hold till next week as well.
Okay. Commissioner McGuire.
I know I should, but just to remind people, we have an AMC Board of Directors meeting on Friday. I'll hold everything else until next week. Thanks.
And I know Commissioner McDonough has stepped away, but I'm going to take the opportunity to just share one thing, and that is that Commissioner McDonough has transitioned off the Region's Hospital Board and served well there for, I think, 16 years on our behalf as I've transitioned on. And I just wanted to take the moment to thank him, and I'll do it again, but publicly thank him for his incredible work as, you know, that hospital came online from a county system and has maintained our representation. And it was really obvious by all the board members, the gratitude and long years of service he had on the Region's Hospital Board. And so I'm glad he's still around to help me over this next year as I transition on, but just wanted to say thank you to Commissioner McDonough on that. With that, we will adjourn this meeting. We will take a 5-minute break and come back to our county board workshop on Heading Home Ramsey Continuum of Care. There's also a 12 o'clock joint courts meeting, so that's why we're tight on time. And then 1:30 we'll reconvene again for Pathways to Success on Probation, Reducing Revocation on our Zoom webinar. So with that, our meeting is adjourned.